So if we're looking at male on its own, we're talking about 50% of cases plus maybe up to 70. So 50 to 70% of infertility cases having a male factor component, regardless if it's solely male factor or it's a combination of both male and female factor. 50 to 70%. That is not ignorable, right? I don't care if you've fathered a child in a previous relationship or if you have fathered a child in this current relationship and you guys are dealing with secondary infertility. Just because it's worked before actually does not mean that something hasn't changed, because years have gone by and things change, right? So that does not what's the word I'm looking for? That does not absolve you of testing because it has previously worked, regardless if it's current same relationship or previous relationship, does not matter. Okay. The fact of the matter is that 50 to 70% of infertility cases have a male component. So this is why we need to get the testing done. Okay. We need these answers because the reality is that truthfully, we actually have more research in terms of male fertility support in the natural health sector, meaning nutrition and risk factors and lifestyle and supplements, because it's a hell of a lot easier to run studies on a male needing to give a semen analysis than it is to run studies on women trying to get pregnant. It's nearly impossible. In fact, the only data we really can gather is in couples doing IVF, and then we have to borrow that data. Whereas in men, we can run all of the research. It's easy peasy lemon squeezy. So we have so much we can do based on research, not just based on what Sally Sue is saying on TikTok helped her husband double his sperm count. And they like dug this weed out of their garden and drank it in a tea every day. No, I'm talking about randomized control trials that have data to back them up. Okay. Are all the studies perfect? Sure. No, they're not. They're not all perfect. Some of them are kind of small, but we have them and we have a lot of them, which is fantastic. So when it comes to getting testing done, if we're talking about building you out a personal care plan that is specific to you and your needs, we can do that very, very easily with the data. When we don't have the data, we're essentially guessing, right? And when we don't have the data, we also don't want to do nothing, because count, concentration, yes, incredibly important. Quality is also important. So I'll argue that even if you've had a semen analysis done, and let's say today we're focused on count, concentration, and those numbers are fine, that still doesn't mean we do nothing, because quality is still in the conversation. And obviously there's lots of other aspects of a semen analysis. And just because your semen analysis looks good, maybe, doesn't mean it's optimal. And it doesn't actually mean that the sperm are perfect, because it doesn't tell the entire story either. So if you don't have testing done yet, that's okay, but it's time to get some. Ideally, we're getting that from your clinic, from a doctor in a clinical setting that you're dropping your sample off at a lab. But if that's not available to you, there are at-home options, one of which that we do like to use in FCM for clients who can't get access to a clinic sample is Fellow. They're one of the few that actually do run morphology and give you good readable data. Some of them you'll just get a report that's like, everything's good, and it doesn't actually tell you the numbers and things like that, which is very, very annoying. So that is the one that we will use. But a clinical study is always just going to be better, in my opinion, honestly, because we're not flash freezing it and then thawing it and then testing it. Like, sure, that works if we need to. It's a great plan B, but it's definitely not my first choice. And if you do one of the at-home options and your numbers are low and wonky and weird, I'm not necessarily going to take that at face value immediately. We're going to get a clinical sample and actually double check that that's correct, because I would hate to be treating something that's not true, right? And causing a lot of undue stress. That's not true. So the best clinical decisions that we can make in terms of how to treat you properly are going to be with having the data. Okay.